SafeWorks Illinois is on a mission to promote wellness in the workplace. They offer a variety of occupational health services, and they are here today sponsoring our segment to share more about how they can help you. Joining me now is Dr. David Fletcher. Welcome to CI Living.
Well, thank you for having me, Jacqueline.
All right, so tell me a little bit about what SafeWorks provides.
Well, it's a private occupational health clinic. We're set up to take care of workers for local employers, whether it's being physicals, drug testing, services for OSHA, or specialized examinations such as truck driver medical certification or FAA medical exams. But the most biggest thing we do is injury care when people get hurt, and that's what we really specialize in, kind of fast track injuries through our clinic.
And if somebody gets hurt at work, I know sometimes navigating the workers' comp, the whole system can be a little bit challenging, but you can provide support with that, right?
That's right. That's kind of what I specialize. I'm board certified in occupational medicine. I've taken care of about 22,000 different people who've been hurt in the job, so I know how to get people through the system. And that's probably the most daunting thing, is people are just overwhelmed by having to file a work comp claim, deal with their employer. Lots of times they have to get an attorney to help them through, and I'm able to help push them through medically to get the services they need as fast as possible and get them to the right people.
And when you say push them through medically, you're talking about if somebody needs a referral, that if they just went to their primary care, it could take weeks to get approvals and things like that. You can actually get them those specialist appointments quicker, right?
That's correct. That's what I'm set up for, sort of a concierge service for people when they're injured. And because I'm independent, I don't have to send to a particular health system. I can send to the best person around. I mean, I use docs at Christie and at Carl, but I also use docs all through the state of Illinois. And by having that type of network, I'm really able to get people, really fantastic care, but also quickly have a sense of urgency. When you're hurt on the job, you're worried about your income, your family, everything like that. And so you want to make sure your provider really takes an interest in getting you taken care of.
And you bring up a really good point, that there is a lot of stress, I'm sure, surrounding how am I going to get back to work? How am I going to provide my family? You can provide for my family. You can actually set up some return to work programs or sort of help them through some of those systems as well, right?
That's correct. I mean, our whole clinic is set up to get people quicker, recover, return to work, rehabilitate. I mean, that's what we're about. And we really try to keep people focused on improving so they can go back to work and make a living.
And if somebody has a particular kind of injury or whatever, can you give us an example of sort of what one of those programs, say somebody, I don't know, falls and sprains their ankle, what might that look like and how long does that process take?
Well, the process is making a very quick diagnosis, doing diagnostic x-ray to make sure they don't have a fracture, start them with simple RICE treatment, rest, ice, isolation, elevation, compression, and then physical therapy if necessary, prescribing anti-inflammatories, maybe non-weight bearing. If they don't get better, we'll do additional imaging such as an MRI, and if they have a tear, we'll make an appropriate referral to a surgical specialist. It all depends on how they do.
And if somebody has an injury or an illness or something like that that's work-related, I know there's oftentimes a lot of pressure to try and get right back to work. How does that, how do you kind of encourage them to actually take the time to heal, but also sort of balance that need to get right back to work? Or, what programs do you refer them to as far as helping with the financial side of things while they're trying to get better?
Well, that's a great question, because obviously the financial aspect is a big thing that we deal with. So we fill out the forms for the employer. We help them file a claim with the workers' compensation carrier to make sure they get benefits. So that's very important, that aspect, the administrative aspect. The other aspect is getting them the right treatment right away. We don't wait for 3 weeks to send them to physical therapy if they need it. If they need an MRI, we're not going to wait for 6 weeks to do it. We're going to do it. We're going to recommend it right away. And then that's what we do to facilitate it. And we don't people put back to regular work. We'll do a transition with light duty type of thing like this. I mean, it's a balancing act when you take care of injured workers. You want to take great care of the injured worker. At the same time, you're cognizant that the employer has cost concerns. And it's a win-win if you give great world-class care and focus on good outcomes.
Absolutely. Well, it sounds like you really do a lot to support employers and employees as they go through the healthcare process. So thank you very much for doing what you do, and thank you for sponsoring our segment today.
Well, we're glad to be here. Thank you for having us.